Hello, everybody. So today we're going to do some. Oh, I have makeup looks better today. I'm not sure why makes it look like I have bags under my eyes. It's so weird. You know why? Because the table's a little bit sloped, so if I was to look at it a little bit different, it might look different. But I don't actually have bags under my eyes, so I don't know what that's about. So today we're just gonna go over some more questions with the Q&A. I'll share my screen. Some things that come up in massage that can be to know more about. We'll go ahead and use the Complete Anatomy app. And so when massaging someone, I had someone with one side of their body higher than the other one noticeably. But she said she had slight scoliosis, so I was like, okay, but I have chiropractic experience because I did 3 years of chiropractic school and palpation. And the spinous processes were all there. They weren't like out of place to the left or right, meaning it's rotated at all. But it was odd that she had a hump on one side. So like if you turn her around, it was a noticeable hump right in here. Now I've massaged some people. Well, one person in particular, females that have large boobs, they naturally, when they're face down, their boobs are going to be right here. And so it's going to make a big hump, a kyphotic curve, make them look hunched. They don't look that way standing. But I've also massaged someone who had a lung removed entirely, a bigger guy, in my earlier days of massage. And he had a caved in side of his back when he's face down. Now, this lady, all of her spinous processes are where they should be. Like, they're not like off, like right here, meaning that it's shifted here. But she does have a slight scoliotic curve where it's shaped like this. It's a little bit off from the midline, but the spinous processes were the same. I would say she's probably like late 70s. Nice lady. She's doing it obviously for wellness, and she's doing great. But this side of her body right in here was really large, and I had to ask if her liver is okay because hepatic function, and then also elderly whenever their digestion tract starts slowing down and they have to start taking iron pills and other supplements and medications. Also, if they're older and arthritic and they have to take painkillers all the time, if she's been known to cause hepatomegaly and liver disease. And so I was just thinking, like, wow, how is her liver function test? Because maybe this isn't to do with scoliosis. Because I seen her from the front and she doesn't have like a large chest and definitely not a larger chest on this side lifting up. So I'm thinking maybe it's hepatomegaly, and I just wanted to advise her to maybe go get that checked out, get her regular health screenings. She told me she hasn't had an x-ray in a while, but it was just a slight curve. So her curve was kind of like this, like that. So the liver is right about there. Also the gallbladder, also the gastrointestinal tract as it goes up and it goes across. Those are points that can become congested with fecal matter. Distortion there. It could also be the stomach, one side of the stomach, or the pancreas right in there. Unless she is in situ inversus, that's most likely her liver, but I mean, it could just be the way her spine is. But it was odd because this side of her left mid back, right in here, was noticeably at least 2 inches higher when she's prone or face down than this side. She has all of her organs. She's a skinny, elderly female, and I mean her bone density. She said she has she's osteopenic. So, and then her muscle tone, soft tissue texture wasn't very dense. There wasn't much to work with. She could handle medium pressure though. She didn't have a loss of sensation. Let's just look at that, the digestive tract, and we'll just look for the liver. So we saw that last time when we were looking at the gallbladder and how it could be referred. It could also be pleural effusion if she couldn't breathe very well, one side of her lung, because there's of the lung right there, maybe the bottom one filled, or maybe this side of her lung was atelectasis, so that this shrunk in, a shrunk in lung. That can happen. I've had a shrunk in lung actually. What happened was, then whenever you have mediastinal lymph nodes, they don't take all that pressing on your lung. The lung starts pressing up, and then before you know it, you have a caved in lung. But you can still use it. All that fluid, I literally had more than 2 liters because they took 2 liters out of my right side. They told me to breathe in real well, but it was an ER doctor. He wasn't a pulmonologist, so he didn't do it the proper way that standards of care would have said to do it, because when he did that, I ended up having fluid in my lung instead of air. So he told me to breathe in really big whenever he was draining it to inflate my lung back up, but I ended up getting fluid instead. And when I did go see the pulmonologist, she told me something else. She said, yeah, he didn't know what he was doing. You should have waited to see me or whatever. And I was like, oh, I just wanted it gone because I couldn't breathe. And I could end up breathing a little better, but I was in the ICU for 7 days while they watched. And that little air machine, you think you blow into it to make the balls go up, but you have to suck in all that air. And if you can't suck in all that air, like you have a little machine, then it looks like you're blowing in it to make the thing go up, the little I guess something in it, but you're actually having to suck all that up. And if you don't have enough lung space, you can't do that. So that's one thing that came up. Massage was fine for her. She just did it for relaxation. Another thing with geriatric massage is you do have to be careful of osteopenia, because they do need to be weight training, resistance training, so they can keep that osteoblastic activity of their bone. Osteopenia, which leads to osteoporosis, and that leads to hairline fractures and fractures of the bones. Bones for the structure of our body. We do end up having scar tissue, and there are some other people that can have a complete slippage of a vertebrae past the spinal cord right into the horse's tail, the cauda equina. Now, some injuries with cauda, other than just the spondylolitosis or spondylolisthesis, when it's just slipping in quarter increments over time and your body adjusts. We do have scar tissue. We do have collagenous soft tissue that helps with our structure, but it's never going to replace bones. So our body does adapt because we do have a righting reflex with our eyes. Same reason if we tilt our head to the side, our eyes naturally want to be horizontal with the horizon. So whatever you're looking at, your body doesn't want to just walk like this, like, okay, let's make sense of it. No, it actually wants to go like this. So if you have any kind of misalignment anywhere in your body, like you're compensating on one side, it will get scar tissue, but your body will start adapting to it, and then it starts adapting up the chain as well whenever you go up. So let's say you have a hip that is off, or you have sciatic pain on this side, or it hurts when you tilt to the left. You're going to start compensating more on this side, and you're going to keep your spine erect here. Well, your body, because you're going down more, let's say you're using this one more and easing up off of the left leg because you don't want to go in that direction, your eyes are going to start tilting this way, and then you're going to have shortened muscles on the right as your eyes tilt. Your eyes are getting compensated with the horizon as your neck tilts to the right. Say for this left hip that you're putting all your body weight on the right hip for, you're leaning on this side. So you're leaning on this side, and then actually you might want to go this way, but you don't want to lean to the left because it hurts your back. And that is another issue altogether. But that scar tissue that forms, it does give you some kind of support, and then the rest of your body holds it. But and then these posterior elements of the spine more into each other. And then you can get what's called facet syndrome, where you get arthritis and erosive activity. Bony processes start forming to help form some stability and structure to protect your nerves. You can look at the well, degenerative disc disease is one way that they say that things happen and your body just adapts naturally. That's one way your body adapts. Other than the compensation, Kirkcaldy and Willis, I think it is, degenerative disc disease, there's stages of how your body initially forms that painful, arthritic, erosive, wearing down of muscle, tendinous, ligamentous, cartilaginous structures, and then starts to calcify and form scar tissue and protect it and stay in that spot. But you should always be moving as much as you can. Let's talk about this horse's tail. So, like, the spinal canal ends about one vertebrae after the TL junction, thoracic lumbar junction, which is T12 right here. This is lumbar, the first one, the upper lumbar. If you're going to get an injury in this first lumbar right here, that's usually from when you're driving. When you're driving and you're seated, your body goes forward really fast and then back, and it will crack in the front right in here. I'm going to remove this. I'm going to hide that rib. It'll crack right here as it's going into this. It can totally burst the fracture right there, or it could be a chance fracture and split along one side or down one side, having to do with elements of vertebrae. But if you get a disc herniation, you're not likely to get it from anything other than trauma right there in your upper lumbar. You're most likely to get it in either your L4, L5 disc between this highlighted vertebrae and the one, or you're going to get it in the L5, S1. In that disc right there, there's a little space. But that horse's tail, if you go into contact, like particularly skiers, boarders, when they run into a tree going really fast down a hill, let's say, I don't know, 80 miles per hour. I don't know if they're going that fast. Maybe they're only going like 30, but it's really fast. Their body, and with that stopping and their momentum, it flips, and they can land head down, smack their tailbone right on the tree trunk, right? So it won't let me actually turn the body in any direction other than this. But let's say they smack their maybe they got the SI joints, the lumbar spine, they fractured, all this inflammation swells up, blood vessels constricted, lymphatics trying to go, tissue there while they get in some clotting factors, those macrophages leaking out from the blood cells going in, trying to build and repatch and repair and see what's going on. Well, it happens with all that inflammation, it can actually start cutting off supply. Now, the sciatic nerve is L4 through S3, so it's, you think of it like 4-3 is the tibial component of the sciatic nerve, and the common peroneal nerve is the 4-2. So it's L4, L5, S1, S2 for common peroneal, and then it's L4, L5, S1, S2, S3 for the common tibial. But they are the sciatic nerve as they leave together from the horse's tail, and they go right here, under this little spot right here. Starts together. They are still wound. Right here, they split, and an adductor canal right at the hamstring heads. So you got your lateral head, the biceps femoris supplied lower down. And then you have the semitendinosus and membranosus. Both of these here, nerve splits right here, straight down, it turns, and then it goes across and right here by the common nerve, right by the fibula, and that is it's going to supply the mostly like the lateral side of the leg, which is the calf and the foot. All of it goes down to the toe, right in here. Okay, you can get what's called cauda equina syndrome, which all that inflammation starts cutting off any of those nerve roots. But what really happens is below S3, because we actually have more nerve roots. We got like the S4, S5, coccyx 1, 2. Those end up getting cut off. They can't be supplied to the brain. Brain can't supply it because all this blockage right here. That's cauda equina syndrome. And what happens is you get they call it a saddle paralysis, where if you were riding a horse, it would become numb right here and on your contact spots of your gluteus right there. And it would be like you couldn't feel anything. Well, then you might not have the ability to pee or the urge to pee. And not a big deal until it is a big deal and you realize you can't pee at all, or you can't control your peeing, or incontinence becomes a thing, which is like you can't control your bowels, your rectum, emptying fecal matter, or your urine, your bladder, your urinary sphincter for constriction, letting out urine. So that would be signs of cauda equina syndrome, and you need to get a surgery really fast. Now, massage can't help with that, and you would not be able to go into a massage to get a massage until after you're treated, and then it can help with the recovery process with all the soft tissue and everything else. And then you need to definitely do whatever your doctor says to get mobilization done, because you do have to mobilize. You have to have this moving. You have to get surgery right away to empty out all that fluid that's causing any compaction to your cauda equina, the horse's tail of all the nerves that are coming out from here. You need to go to the emergency room. There have been cases in malpractice where there was a case where a chiropractor couldn't treat someone. They sent them to the emergency room and they knew it was cauda equina. They told them that. The ER didn't want to deal with it because they're like, oh, they got treated by a chiropractor, so we're not going to deal with it. They went home. Somebody else came in. It was 24 hours later. This is on a malpractice, the top malpractice thing. We learned this in jurisprudence. They tried to do the surgery and couldn't because scar tissue was there. So what ended up happening was the guy ended up being paralyzed, right? Because there was just too much scar tissue, roots, so they couldn't build and repair. Once you root, it's done. And they wanted to sue the chiropractor. The doctors wanted to blame the chiropractor, but the chiropractor was like, no, I did my part. I sent him to the ER. It was 24 hours before. When did he get the surgery, right? And the malpractice people are like representing him, and they're like, yeah, like you need to ask, because this isn't his fault. It's not my client's fault. We're not paying you anything. That's your fault. You need to go take that up with your ER doctors, because they're supposed to be life and limb. And accordingly, they had other surgeries going through. Doctors were needed. They weren't called in. Nobody was called in. Nobody took it seriously. And now this guy's paralyzed. Anyways, what ended up happening? The malpractice suit of the chiropractor didn't pay. They didn't have to pay out anything. It didn't go in against the claim. The doctors, the hospital, all got sued, and they ended up paying that guy like a lot of money. Millions. And you don't hear about that, right? Okay. Because they public. You hear more about stuff that happens. Profession. You can read my accolades to learn why I'm not a chiropractor, and I have 3 years of medical school in chiropractic. So that's all information I learned from chiropractic school. All right, so that's the cauda equina. Let's just look at that cauda equina towel so you can visualize this happening. As soon as something happens and you suspect you have those symptoms, you can consort with the Merck manual, MERCK, and then show, hey, cauda equina, I got this. You need to get me surgery right now. I'm here at the ER. on this right now, or if somebody you know, or like they're going into like a contact sport, they get the same saddle paresthesia and they have incontinence, or they can't pee, or they don't know if they're having to pee or whatnot. You have to give it a little response. Does constrict your urethra, and it bladder expand because it doesn't know what to do, and I think it's still in the fearful stress state of flight, or freeze and appease. Fight, flight, freeze, or appease. Okay. So let's just look at that nervous system, and we'll show you where. Also, with this nerve root, if you ever have surgery now where you have to remove an organ, that last time we talked about the gallbladder disease, and the lady was having pain there, but she had already had her gallbladder removed and she was in pain, and it was like 5 or 6 months before that massage that she had pain. And I'm thinking, oh, it must have been they didn't give her an epidural before they removed the gallbladder, because neurosurgeons, because of their recent publications, they're keeping up on their continuing education, would know you give an epidural now before you remove any limb or organ, because limb pains or organ pains is almost diminished completely when you do. Because if you cut off the nerve supply before you remove it, it's not fearful after anesthesia. So you got to numb it, then you put them under, then you remove everything, and then they wake up and they heal, and it's like nothing really happened. All have that organ or limb. Okay, so that was off, just referring to something else, a little tangent right there, but we're going to look at the nerves, and you can see I'm going to show you where the spinal cord is and the nerve roots. It does have a covering. So this is the meningeal layer. This is the spinal dura, the lumbar. Now, okay, so we're on the T12. Then you go down, and then you're going to be right in here, and this is where the horse's tail is, around L2, because that's going to be the end of the spinal cord, and this is where the nerve rootlets come. That it's here. Horse's tail, not cord, is it? Okay. Well, now here's L1. Let's hide that one. And here's our spinal cord. It's the meter of the spinal cord. Those meninges can get inflamed. You get bacterial, or bacterial meningitis is the worst, because your chances of survival aren't very good, because it just inflames so fast and it covers up that whole canal that like you can't get really any neurovascular supply to function. What you would do then, you definitely want to go to an ER and a doctor and staff that are ready for you to get that handled. They have their own way of treating it. I'm assuming they're going to have to let out some pressure though. So they'll probably drain some fluid from your spinal canal, because all that spinal fluid they can drain. And they'll probably do some kind of measures up there. I don't know. That wasn't in our scope, so we only touched on some stuff if it was in like 20-year-old textbooks and whatnot. There's your horse's tail, not a spinal cord. It is part of the spinal cord. It's the central nervous system still, the brain, the cord, the nerve roots. Once it leaves this canal, it becomes the peripheral nervous system, where all the nerve roots are. I mean, they're all sensory and motor, but sensory is actually in the dorsal end right here near the back end of the vertebrae. The front end is the motor. You get anterior lateral sclerosis, and that's going to be spasticity. It's called an what do they call it? An upper motor neuron disorder reflex. So, and then a lower one would be the peripheral. So anything you sense with your interpretation to do a motor response, you're going to go up the spinothalamic tract, spine to the thalamus of the brain. Any motor action, it's going to go to, or any kind of reaction, it's going to come from the cortex or thalamus down the spine. It's going to be the corticospinal or corticospinal tract. Yeah, that sounds right. Cranial nerves are different. Those are going to be what affects your senses, as well as like, okay, so cranial nerve 1, that's going to be your nose. That's your sensory. That's the only one that can bypass the whole spinal thalamic tract and go straight to your amygdala without going to the cortex. No spinal thalamic presentation. That's cranial nerve 1. That's the ophthalmic nerve, cranial nerve, or not ophthalmic. What is it called? Haven't used it in a while, but it's the cranial nerve for your smell, which is something with an O. And then your ophthalmic nerve is for your eyes to see. And then you got the cranial nerve 3, that is cranial nerve 1 and 2. Okay, so 1 doesn't go to the brainstem, really to the cranial nerve 1 is the smell. That one goes straight to your amygdala, your seat of emotion and stuff in your deep brain. The optic nerve, that's cranial nerve 2. That's going to cross at the optic chiasm right above your pituitary gland. We looked at that in a previous discussion. And that is going to go to the midbrain. It's actually going to go to your cerebellum for processing, and then to the cortex. And then the cranial nerve 3 is a motor function to the eyes. It's for pupillary constriction as well. It has a branch for that. And then it also has, I believe the to open, I think is that one. Because we also have facial nerves, which is cranial nerve 7, and that one involves the eye opening or closing. And then, there's a whole process for that. So 3 and 4 and 6 all the direction of the eye moving, but 3 also is pupillary constriction. So it's LR moving to the side. Lateral rectus muscle will move it, and that's the only function it does. If you want to look out, that's cranial nerve 6. That one is on your pons of your brainstem. Your brainstem is your cord, your medulla, your pons. Your pons, right above the pons, that's where the vertebral artery come in the back and they go over, and that's the pons. And then it splits into the circle of Willis, where all the carotid arteries, the internal and the external, come together. It's actually the internal. And then you have that supply in the circle of Willis and supplies blood to the brain. Sinuses, and those are for removing blood from the brain, and they also clean out cerebrospinal fluid. There's a vomiting reflex, vomiting center, like whenever you brush your teeth or your mouth, you're like that. That is not covered by the blood-brain barrier, so it's a sensitive area that your brain can have contaminants leak into it if it gets into that blood supply right there. Not to scare you, but there's a possibility, because there is a brain barrier. Only tiny elements like lead and other tiny toxins can get in. They do say glutamate is a painful substance, so MSG, monosaccharide, or something like that, glutamate. But if you take magnesium, it blocks glutamate, so you don't have that problem. That can help with the brain. Okay, headaches. Headaches are good. We went over this on a different discussion, but this first vertebrae up here, this ring right here, this is where the occipital nerve and then also the vertebral artery go over. Good. So cranial nerve 4, that one is actually something that moves your eyeball inwards, down and in. That's the only thing cranial nerve 4 does. Midbrain right above, and that is right in the hypothalamus region right there. So cranial 3, 4. And then you got on the pons right below the basilar artery, you have 5, 6, 7, and 8. And then the medulla is 9, 10, 11, 12. Okay, so 12 is for your tongue. Stick it out and it should be straight down. Sensory for the tongue if you want to go with taste. We could go all over the place. So none of the stuff actually came up in my things on the way there, okay? We're just going on little tangents on the way there. Just your learning all this information that's just like a big smorgasbord or whatever you want to call it of information. Okay, so the tongue. You have sensory, you have like 4 cranial nerves, you got 12 controlling the motor supply there. If you have a lesion in your cranial nerve somewhere in the brainstem at the medulla, then you're gonna go when they say stick out your tongue, and it goes like that, then I mean it's pointing to that side of the lesion. Now your uvula is cranial nerve 9. Now if you go and it's not in the center and it goes to that way, it's the opposite. It means the lesion's the other side of your brain. Cranial nerve 9 is also in the medulla. They have specific regions of the medulla. Cranial nerve 10, that's your vagus nerve, and that's what is also connected with the autonomic nervous system. So it goes all the way down. It's the only cranial nerve to go down past the neck into the diaphragm and digestive tract, because that sensory stuff, like digestive responses. Cranial nerve 10 is also in the gag. When you go and then they stick something onto your tonsils to see if it reacts. Like if you get the gag reflex, that's cranial nerve 10 as a response. Okay, so cranial nerve 9 also is sensory to your tongue. It's called the bitter 9. So the first 2/3 is cranial nerve 5 and 3 for sensory. Like 5 and 3, I think that's right, 5 and 3, or 7. So so 5. What is 3 for it there? Okay, so I can't recall what 3 is, but I feel like 3 is there. 5 and 7. Cranial nerve 5 is the muscles of mastication. Top 2/3, you're going to sense your food. Cranial nerve 5. Cranial nerve 7 as well. And then you're going to have the cranial nerve 9, back 1/3 of your tongue. That's for sweet. It's going to be on the tip of your tongue. If it's salty, it's on the sides. If you got the, what is it called, that umami, anything with umami, whatever that is, I guess it's in like artisan foods, it's going to be the center of your tongue right there. So just for taste, that you know you're working. And that's why some people, they believe if you eat a variety of different foods all the time, you're always stimulating your nerves. Well, your cranial nerves, you're getting your 5, your 9, your 7, and I believe your 3. What is 3 for? Well, probably not, but your 12 also. And then, and then 5 is also for the trigeminal nerve. It actually splits. There is the frontal, the frontal division. There's 3 divisions, so it goes like this. So there's the frontal one, and then there's the maxillary one, and then there's the mandibular one. I believe it's 1, 2, 3. Trigeminal division 1, 2, and 3. Those are sensory for the face. Okay. The motor function for cranial nerve 5, which is muscles of mastication, which is like you gotta push with this on each hand or your tongue, like that. It's like your masseter and your pterygoids deeper in there. Yeah, so that occipital nerve supplies. Now there's also a brain supply to the external carotid artery. It splits. There's the middle meningeal artery that is from that branch, and it branches out to supply your face. Now you can end up getting headaches from compression from those arteries or from the veins. And then also there's different types of headaches. Now, if you have a band-like headache across your head, your forehead, like this, like a headband, like you're wearing a headband, it's going over your super truncular, super ocular nerves, and then also you're going to have some blood supply there, and it's going to be bilateral. It's not going to be on one side. That's a tension headache. That's from tension in your muscles pulling on it. Now there is a muscle, the frontal occipital muscle, that pulls right on this frontal bone of your forehead. It goes all the way to the back on your occipital. It's a whole fascia. It could be really tight. Cranial massage would be really good for that to help relieve some tension there. Usually in young males that are alcoholic. And what happens is it feels like the day for about 30 minutes. It'll feel like really intense pain in the back of one eyeball. And it never completely goes away. It'll come back later. That's a cluster headache. And that's mostly in alcoholics, mostly young males, but some females do get it, and some older people too. I've never ran into anyone who has a cluster headache. I've never had a cluster headache either. Now, if you get a migraine, that is tricky because that could be cardiovascular related. It could be a sign of a stroke. It could be a sign of hypertension, hypotension. It could be anywhere on your brain. Now, if you get an aura migraine, because the optic chiasm cross, this isn't something they told us in chiropractic school, this part right here. Because it crosses over the optic chiasm and it is over the pituitary gland, there's a possibility that pituitary gland, if you're hormonal, is causing you to get that aura migraine because optic chiasm is right above where your eye vision is crisscrossing to go to your cerebellum down that tract. If it is enlarged or doing a lot of activity, giving off heat as it's getting that that processing, because there are two parts of the pituitary gland. There's the posterior, which is for oxytocin and ADH, antidiuretic hormone, to prevent you from getting hypotension. Hypotension, like when you're low on blood supply to your heart. It'll be released so that you retain water and sodium. Now, those are electrical. They're more nerve stimulating. And then oxytocin also, it's in pregnant women. And the thing with oxytocin is if you're pregnant, it would stimulate your uterus to contract and your mammillary glands to pump. So, like, stimulating a baby feeding. To have oxytocin, you would have to have had a baby to want your body to contract the uterus, be pregnant to contract the uterus to expel the baby from your body, and then also the feed the baby. Now, in reflexology, and when we first learned massage, they said, don't massage in this foot right here because of this canal. They said if you massage the ankles, there's a chance you will force the mother to deliver early. There have been no medical records, no confirmations that this is a fact, but people still don't do it just in case. Because that is where this medial malleolus canal right here, that is where you get the tibial nerve. You also get the flexor hallucis longus going through this little canal right here. You get the vein and lymphatics going to the foot, so the veins coming up. That femoral vein going up, supply from the pelvis right here. Then you got the mom's blood, her uterine arteries supplying blood in the membrane sac from her uterus supply to the membrane sac to the baby's umbilical cord to the membrane sac. That umbilical cord is getting oxygenated, nutrient-rich blood in the vein from that sac to the baby, and dropping off used waste, deoxygenated blood in the artery to the membrane, and it's going back to the mother through her veins. Now, the baby needs that amniotic fluid for protection and also to protect from bacteria and stuff from affecting the fetus growing. There's also okay. Now, it could all the blood flow, but there's nothing that says it's going to put them in labor. So you can massage their ankles, but because you're taught, and times are always changing. You're always adapting to healthcare stuff, but findings and continuing education to give the best service you can up to date for care for your patient, your clients, and not harm them. So I would say you don't have to massage it hard. Nobody really massages it hard on the ankles anyways. And the femoral nerve is going to come up and it's going to take away that blood. The femoral artery is going to go down and supply blood. Your lymphatics are still going to clean it up. It's going to go over here. The blood supply, it's not going to affect the cervix at all because you got the birth canal, the cervix, to the membrane, to the uterus, inside the uterus. They got the there with the fetus inside it. You're not going to dilate that cervix by doing anything that could affect not that blood supply, because if the amniotic fluid is impacted, if it is affected, because there's a higher risk every time they insert a needle to test the amniotic fluid, especially when they're testing for like fetal alcohol syndrome or mental Down syndrome. They lower the risk of the baby having a good health, but it increases their survival as well because they're testing it to find out if they're going to be a healthy baby in every aspect. That cervix is the doorway to the uterus, and it's only going to dilate when the mom's ready. Her uterus is going to contract. Now, if the is infected or the baby is somehow threatening the life of the host or the life of the baby, it's possible the cervix could dilate, but it wouldn't be massages on your ankles. That's not enough to cause a disruptive blood supply to the fetus. Now, what is wherever that baby is that's growing in the uterus, because you got, so you got your bladder. I think we're looking at the female. Okay, so let's remove this. You got your bladder, then you got your uterus in the, I don't know, in the uterus that doesn't have a baby in it. Bladder in front, uterus behind it, rectum behind that. Now, when the baby starts growing, the uterus grows, and it's not attached really right there, even though there is the round ligaments that attach the uterus and the ovaries, and you have other ligaments. It is allowed to grow. The baby grows with it, and it moves around in the amniotic fluid. It's going to be above the bladder, and then when it's above the bladder, the vein and the artery, like the aorta and the inferior vena cava. So we're gonna, all right. Let's just look at that. Okay, so we'll hide this. This is the interlateral part of the peritoneum, and if that peritoneum is filled with fluid, and it stretches the sac, it can't really hurt to walk or move at all because there's like a leakage in there. This is our fat omen that protects our viscera. Now, your large intestine is fastened. It's also got attachments to the pancreas as well. These small intestines are not. They will come out if you have a C-section. Talk about something and it got past me. So it was a tangent on a tangent. Now, babies, when they do and recycle it, they don't breathe, of course. They don't breathe through their lungs. And their lungs, they don't develop fully until they have for their, it takes like 37 weeks. 32 is really pushing it, but technically 32. But they do have stuff now in the hospital to give them that can breathe. But if you have a baby that's underdeveloped lungs, they'll have stuff at the hospital for that. Okay, now their hearts, because we as adults have 4 chambers, and then our heart has openings between it when you're a fetus, breathing in and getting nutrients and oxygen from its umbilical cord, which closes up when it's born. Once it takes its first breath, that's supposed to signal that there's oxygen from the lungs need to work. The heart has this valve. It's a valve that allows the blood to go through that's oxygenated. You breathe your first as a baby, turning into inside the womb. That breath is close that little door between, I believe it's the ventricles, and then you're breathing through your lungs normally. Now there are tetrology of fallout where it doesn't happen like that. It doesn't close all the way, or there's some other disturbance of the heart, and so they have to have surgeries, and that port. But normally, the cord closes from that supply. The heart now doesn't use the oxygen from the blood supply that it's no longer getting from the umbilical cord from its mother's uterus. It's now going to get from the air and the world environment outside of it into its lungs, and its lungs are now going to supply the oxygenated blood to the heart from its used blood it gets from the heart and the body. I want to just go over that real quick. If these are going to fall out if you have a C-section, okay, because they're not attached to anything, but you can put them back and they can find their way right back to where they're at. Interesting story. A lady had fit, total regular bowel movements, nothing, and think that she was even susceptible to colon cancer. Working out, she felt a tight pull in her lower abdomen right in here. And then it didn't go away for 2 weeks. She went to the doctor, like, oh, you got colon cancer. And then they operated and removed it. And then she still had pain like 4 months later. Pretty good. So what happened was she probably had an enlarged apple type of colon cancer. And that's since it was on the left side, that's called a left-sided colon disorder, left colon. Yeah, and that ligament that was attached to abdominal probably was so enlarged from buildup that it popped off in the abdominal cavity, and she had that pain. And then there's still room for this because it can stretch pretty largely for fecal matter to pass and make it seem like you're having normal bowel movements and whatnot. And gas also passes, but a serious condition and not know it. But advances in healthcare. Anytime you're worried about your health, just go to the ER, and if you trust them, do what they say, and just find a way to do everything else, because it'll find a way. Really, you don't have to worry about it if you're worried about the medical expenses or whatnot. If you're not alive to pay them, you don't need to worry about them, do you? So, yeah, you should just go to the ER to pay for it. And you don't have to pay more than 20%, and that's even after court. You can just go to the court and be like, I don't got shit. So, and if you don't, then yeah, otherwise they're going to put a lien on your house. So, I don't know. All right. Yeah, that's the best way. If you have cancer of any type, you have to get it excised, removed immediately. Now they're saying endometriosis. That's another thing. Female reproductive system can transmit pain to your lower back. Okay, but let's go ahead and remove these lower intestines. That's the ileum. So we'll hide that. And then we'll hide the jejunum. Just look at our artery in here. Let's add the abdominal aorta. So if you have a baby, if you're getting a prenatal massage and your baby is now large and you're going to be and that's floating in your uterus, in your abdominal cavity, right above your bladder, into your ribs, there is a chance that you might be on your side too long, and then you'll get anxious and lightheaded and fall asleep, but you will feel sick. It won't be like you're relaxed and falling asleep. That's because your baby's not getting any oxygen because it's laying on your. Let's remove that. Right in here on your side. Now, if you look at it from the back, it is slightly to the right than inferior vena cava, and then your aorta is slightly in front and to the left. but I mean the aorta can get pretty big. So they're right there. If it's the aorta, your baby could be on your side, even on your intestines, and laying on your inferior vena cava or your aorta, abdominal aorta. Either one's going to affect blood supply to or from the uterus and the baby. So you do have to be careful when you lay on your side too long. But that is the best way to get a massage. And usually there's no problems because it's so far in there. The baby's usually out here. But there is a chance. So maybe if you have it on one side, because some people use that under the abdominal, it's possible that's cutting off the blood supply. And the baby's like on that. But in a big, round, amniotic fluid membrane sac in your uterus. Okay. And yeah, so that was with the lumps right there. And then the migraines could be cardiovascular related, hormonal related, or migraines could be related to the pituitary gland. The anterior portion of your pituitary gland reacts to stress, and it releases that through blood markers as it gets it, because the anterior pituitary gland is hormonal, all hormonal, so it relies on the blood supply that it's receiving there. And those adrenal glands are above the kidney. They look like little fat sacs, but they're glands. The glands above the kidney, where the corticotropin releasing hormone acts to stimulate mineral corticoids for stress, and with the for the stress response. So you have the 3 layers of the, let's go ahead and just look at the urogenital. We go in here, here's the kidney, and then it doesn't have the gland right there, so we'll go ahead and put endocrine gland. It looks like fat, right? Looks just like the abdominal fat from the earlier that we saw. So this one is a pyramid. They're pyramid shaped. They're above the kidneys, and they're layers. So the inside is the fight, flight, or freeze and appease, and it is okay. So there's a mnemonic: go find Rex, and then MGS. So mineral corticoids at the top. That's where the that's where electrolytes are needed, blood supply, blood pressure, and electrolyte balance for your minerals in your bones as well. And then you have the second layer on top, because there's 3 layers on top of that middle layer. Cushing's syndrome or disease, or Addison's disease would be the mineral corticoids, and there's an imbalance. Cushing's is hormones, hormone related, that one, or silver ones, and then which is stretch marks, and then skinny, wobbly legs and arms. And that one is from also an imbalance in that other hormone. I think it's blind hormone. Cushing's. I feel like it's cortisol. Too much cortisol. Yeah, too stressed out. So that's the glucocorticoids. That's what's making it when you're stressed. It also creates gluconeogenesis when you have steroids to use all your fat and burn it up. You have the cortical response. It's going to save that fat once it's used it, and then it's going to put it right back on your body. Same with other fat that you eat in your diet, so that you're and then it might even break down your muscles too and make energy stores from that as well. Rhabdomyolysis, that can destroy the kidneys too if you have that, because it's too much protein in your body. And then the sex hormones for estrogens, androgens, and testosterone, and then of course the adrenaline in the middle, filtering a lot of stuff. Let's talk about the liver. So the liver, yeah. So hepatomegaly is how we started this discussion. The liver really does so much. It processes the first part of calciferol. It processes it from the sun, the UV, made. And then it goes after that, and then from the kidneys, it'll go to your gut and make vitamin D, calcium as well, calcium and vitamin D in your gut from the gut microbiome. So this also makes urea. It makes the urea for your kidneys to eliminate from the proteins. It's what breaks down lactate acid, also pyruvate, in from working out too much. It detoxes your body of toxins, environmental toxins, and diet. It processes a lot of the fat soluble vitamins that you need. And you can only get from fats. The liver makes the bile that's stored in the gallbladder to process fats and proteins, break it down so you can get all. The liver also so it does the nutrients, and then so when it's cleaning up toxins, you can lose up to 80% of your liver and be fine. You can actually donate part of your liver and your back. It will work fine. The only thing, if you have hepatitis, C or B can kill you. D, if it's with B, can kill you. Hepatitis C will take like a few months to kill you. Really watch what you eat and drink. Dirty water, fecal stuff in your food. Hepatitis C from just people or animals. Because that's transmitted from all body fluids, vitamin C, and also with food, vitamin A, food only, and you're not likely to die from that, but you can get an enlarged liver. Hepatomegaly, some people don't even know it. Like if you get hepatomegaly and enlarged liver, it could be because you have liver disease. Your detox are flooded, and then they're not really working. They're growing uncontrollably. You can also get splenomegaly too. And hepatomegaly, they can be from someone who has sickle cell anemia when it's not working very well, and it makes the spleen work harder to store and process, as well as the liver for processing. And then, so the liver does a lot of things for our body. Now, if you do have liver disease, so it makes vitamin D. Okay, it processes your fats. It processes your lactic acid from working out too much. It processes in your body that you need to get rid of. It also is something that recycles cholesterol from your body. It is responsible for this. It can take that fat and make it into energy, into triglycerols, which your body can use. From fat, it will recycle 95% of all the fat in your body that you need for all your plasma membranes of every cell in your body. And then also for the sex hormones, strong and give your muscles strength. Any hormone really needs it. And then so the fats and lipids, they're useful. So what happens there is that's why you also need to take fiber to clean up any excess cholesterol in your body, as well as fish oil. Fish oil will make your cholesterol high because it looks at your total cholesterol of your low density lipids, which are said to be the good ones, and your high density lipids, which are said to be right. I think that's right. HDLs. Yeah. High density lipids. So like whenever it's like triglycerol from breaking down from a fat, triglycerols, and then the cholesterol, more cholesterol, and it starts going down. So that's part of biochemistry, but just know that cycle, and 5% you eliminate in fecal matter. So you need to eat fiber regularly to detox that. Otherwise, you could have backup, and it could be a big lump. basically you can't remove. Actually, don't want to take too much to fiber at once because that can make it irritated and cause pain, and pain causes inflammation. All right, yeah, so that was quite a bit of stuff to go over today. A lot of things I've been noticing when I do the shoulder massages is stretching these scalenes right here, working with those scalene muscles. Also stretching the rhomboids by retracting the arm forward, stretching the pecs, the pec minor onto this coracoid process. Stretch that out. Stretch the coracobrachialis out. Stretching those deltoids as well, the external rotators, loosening up the shoulder articulation. This scapulothoracic movement is very necessary for a good functioning shoulder. And it also helps prevent compression around your neurovascular bundle, your brachial plexus, and your axillary artery or subclavian artery turning into the axillary and brachial artery, as well as the vein emptying out the arm emptying into the heart, but also passing into your clavicle. Stretch those out. Stretch them out. Because pull on this clavicle and compress it. A tight neck muscle, scalene muscles, especially the anterior one, can compress it from the front. The middle one tight can compress it from the back. Upper traps can start being really tight, and they're connected to this spine of the scapula right here. So if they're really tight, they could start lifting the shoulder and compressing this radial artery here, as well as the back supply. The radial nerve, and then the around into the posterior circumflex artery of the arm. That can cause paresthesia, numbness, tingling, and pain down. When you feel it in your arm, you're just like, it's still achy or sharp, it's numb everywhere because it's losing that blood supply. But if you're questioning, there is a test you can do. So you go to your wrist, and then this side is your radial, this side your ulnar. See if you have a good blood flow by just lightly pressing, because it's very superficial. It's pumping regularly. It should be pumping like about 60 beats per minute. Right? Yeah. So that's pretty good. I think it's 60 to 100 beats per minute. And then for an adult, because they need more. So you just check that, and then you can also pinch your finger. It should be only pill for like 2 seconds, and then peak again. That should show if you're getting proper blood supply. If not, if you are, then it's probably a nerve being compressed. And the nerve passageways, they usually run with the blood, but the blood branches out different ways as well. You just want to make sure you decompress all those muscles. Spot for nadir teres, spot for the median nerve. Those are for the thumb, middle finger, and the index finger. The inside elbow, the ulnar nerve right here, pinky and your ring finger. And then the back nerve right here at the outer elbow, anconeus, stretching that. That supplies the whole extension of hand and wrist and fingers, as well as extension of the elbow. And okay, yeah. So loosen all that stuff up. Okay. I know this is just today's Q&A. Stuff's coming up. Always keeping up on top of things. A lot of people get sacroiliac joint pain. The sacrum. So your sacrum's like in the middle, right? And then your legs are like this, right? They have to walk like this, right? So your sacrum is actually, when you're walking, one side has to be an extension. The extension side is the back leg. The forward leg is the flexion side. So this has to be going into flexion, while this one's in extension. You could just push in right above the hip bone right here, and then downwards into that gluteus muscle fascia. Trying not to compress the piriformis, but as long as you're right along this joint line, it's helping to loosen that gluteal muscle and the deep muscles like the piriformis and the gemellas and the obturations. Yeah, so that pressing on the inside and the outside of the piriformis muscle will loosen it up, as well as blood supply on the back end, because that gluteal muscle wraps all the way around. Okay, and it has sites, attachment sites here, 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 going to the back of the femoral bone. Okay, so loosen that area up off the hip bone. Press down along the iliac crest, along the sacrum, down into flexion, and that's helping to open up that SI joint into flexion, pushing up and off the bone, down and off, but not trying to compress the piriformis muscle. That'll put it into extension. So just keeping it when you massage will help alleviate sciatic pain symptoms as we push strings, and then it starts breaking off here too. Posterior tibial cranial nerve right there. So that's why you need to have iliac joints. You need to have sacral iliac joint health. So that your sacrum is moving like it should along the ilium, and you're moving fine. You know, whenever you stretch, to relieve pressure off your pelvis as well as ilium and hips and your femoral acetabular joint. And then when you stretch your hamstrings, you're relieving pressure off the back of your hip, as well as like the ischial tuberosity, your tailbone right there. Okay, so I guess that's it for today. This was a longer Q&A because I had a little stuff to go over as it came to me, with stuff that you can definitely handle in massage. Okay, so we talked about quite a bit of things today. Okay, hepatomegaly, cauda, equina, ER visits and urgencies for medical care. We talked about fetal blood supply, prenatal massage cautions with blood supply, tetrology of fallout in heart after birth. Then we talked about some cranial nerves, brain stem. We also talked about the of course, the sciatic nerve root, the pelvic floor, and cauda equina syndrome, as well as did we say cranial nerves? Many cranial nerves. And then okay, and more. All right, great. So hope you enjoyed this Q&A. If you have any questions and you want answers to them, and you want to know anything about massage or want some advice with your next massage session to help with some condition you or your loved one has, shoot me an email at Janice@thenegotiator, and then I will respond. All right. Thanks so much. Have a great one.